Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Hello, this is Jason Edwards, and this is another episode of Doc Discussions. I have with me my good friend, Dr. Bobby Shah, who's a pulmonologist. He's a lung doctor, and sometimes lung cancer doctor. Bobby, how you doing today?
I'm doing fine. Thanks, Jason.
And so can you tell me a little bit about your practice and kind of the typical patients that you see in the clinic?
Sure. So, like you said, I'm a pulmonary physician. My background is in pulmonary and critical care medicine, so it's a little bit of pulmonary plus also some other areas too. But, at St. Luke's, where you and I practice, our hospital, our office is set up where I focus on the pulmonary. The critical care is handled by a totally different team of doctors. Even though I have the background, the education, the training to do something like that, we've got a slightly different setup here. So pulmonary medicine for me, my practice involves taking care of patients that have, any sort of respiratory or lung complaint. Things like that could include cough or shortness of breath. Unfortunately, because of smoking, lung cancer, like you were saying earlier, comes up a lot. Lung cancer screening is something we do nowadays where patients get CAT scans once a year. And so we find all kinds of abnormalities there. And when patients have things there and physicians see things there, they often refer them to us, to help sort of decipher, what the radiologist is seeing, put it into some sort of context, then hopefully kind of, figure out with the patient what the next right steps are. So that's a lot of what we see in the office here, at St. Luke's. And my day-to-day operations are pretty simple. I see patients in the hospital sometimes too. Part of being a pulmonologist means coming over to the hospital if a patient gets admitted to the hospital with a respiratory complaint. And if the hospital team, the hospitalist, are having any trouble figuring out what to do, if any other tests or treatments are necessary, they'll often call one of us to come see them, either myself or one of my partners. And so a lot of times I'll go over to the hospital and see patients too. And then I spend the bulk of my day in the office, 10 to 3, 10 to 4, seeing patients. And then sometimes the third part of our practice is doing procedures. Patients, like we talked about earlier, that have possible lung cancers will sometimes need a biopsy to figure out what's going on. And there's different ways to do that. And one of the techniques for doing a biopsy involves me coming in and trying to help those patients figure out what's going on or what those abnormalities are. So I'd say 3 parts. There's the hospital work, there's the office work, and then there's the procedures that tend to make up a large bulk of my day.
Yeah, it's kind of nice to have a few different settings where you practice medicine, so you're not doing the same thing all the time. Some people like doing the same thing all the time, but a little bit of variety is nice.
Oh, yeah, absolutely. And that was one of the reasons why I picked pulmonary medicine. I liked the critical care aspect of it when I was in med school, when I was in training. I liked having that option because I thought that it was a really fun part of being in the hospital as a physician. It's probably, one of the places where you tend to exercise that brain muscle the most. You're in there, people are at the sickest, they're at the most vulnerable, they need your help. And it was really exciting to do for a long time. But as time went on, it got to be a little exhausting. And so having the pulmonary side to fall back on was nice too. Yeah. And then, like you said, even having that mixed day to day kind of breaks up the monotony a little bit.
Yeah, I really think critical care doctors are some of the most respected doctors in the hospital, just because they have to think a lot and they have to know a lot of different systems, and they're dealing with very complex problems. And so, when the patients are at their sickest or their most infirm state, you're the guys we asked to help them out. And so
it's challenging, it's fun, it's exciting, it's exhausting at times, but it's also extremely rewarding when you're able to help someone there too.
Yeah, very cool. And so, not only, and everybody, the pulmonologist is kind of well connected to surgeons, oncologists, internal medicine doctors. So everybody, in a way, it's kind of the hub of the wheel of the current medical system. Everybody knows Bobby, at the hospital, which is
I think
good.
when you look at the hospital statistics, whether it's St. Luke's or other hospitals, and you look at the reasons why people get admitted to the hospital, respiratory issues tend to be in the top 3, if not oftentimes the number 1 reason.
Yeah.
And we're just coming off 3 years of a pandemic.
Yeah.
That was a large portion of what people were coming to the hospital for, whether it was their physician's office, the ER, the urgent care, or in our case, being admitted to the hospital. Pulmonary reasons were probably number 1 these last few years.
Yeah. It became clear very quickly that the pulmonologist and the intensive care doctors seem to kind of have the brunt of the workload, when it came to dealing with COVID. Of course, your internal medicine doctors on the floor and your emergency room doctors, and the nurses.
And don't forget the nurses.
For sure.
Yes.
And everybody,
the
janitors, you had to have people go in and clean those rooms. But you guys were really hit hard, I think, by COVID.
It was a challenging 3 years. There was, times coming home exhausted, times that we came home feeling defeated, times that we came home wondering, what was going on. We spent 4 years in med school, 3 years in residency, 3 years in fellowship, all these years in practice, decades for some of my partners, to all of a sudden have this disease that's not following the rules, not playing by the playbook, not doing, anything we expected. Some of my senior partners likened it to when they trained during the early HIV days.
Yeah.
Where all of a sudden there's this virus that's doing things that nobody really knows even what it's called or what it is or where it's from, or what to do with it. We were having conversations there where they were thinking, this is so similar to what we went through decades ago.
Yeah.
And to be full circle and to go through something like this again, it's really humbling.
Did you reach out to any of your colleagues at other institutions during the early onset to try to, because you're figuring it out on the fly, how do we treat these patients?
Oh, for sure. So when I did my training in residency, one of our chief residents went on to be the critical care director at one of the bigger hospitals at the University of Washington.
Okay.
And St. Louis being in the Midwest, we're kind of landlocked, and things were hitting us probably 3 to 6 months later than what it would, and maybe on the coast, whether it was the East Coast or West Coast.
Yeah.
So talking to physicians that we knew in training on the West Coast, talking to physicians in much more central hubs for travel like Denver, hearing what they were going through, getting any advice from what they were going through was a big part of what we did here.
Yeah. And Washington got hit early.
Yeah. Washington got hit early. And so to talk to my former chief resident, and to hear what they were going through was extremely helpful.
Yeah. And so, what outside of medicine, you have 3 children.
Yep.
Your wife's a school teacher, and you're busy. I think you're busy at work and you're busy with the family. But it seems like you do a good job of kind of keeping it all together. Your kids are doing well.
I wouldn't say that all the time as we're doing a good job. Well, we're trying our best.
Look, I'm not.
I mean, as a parent, you never feel like you're always doing everything right.
Yeah. Well, okay. I'm not comparing you to an ideal. I'm comparing you to other people dealing with that kind of adversity or responsibility.
Sure.
And I think you're doing well with it, but I know it's a challenge, of course. Yeah. And so I know you like traveling with your children. What other stuff do you do in your spare time? I know there's not a lot of it, but
with a 15-year-old, a 13-year-old, and a 9-year-old who's almost 10, free time is a hot commodity. I'm guilty of, I do a little reading when I can. It's been a while. I'll be on the wagon, read for, a year, knock through a few books, and then I'll fall off the wagon for a year and just not read for a little bit. One of my guilty pleasures is binging on TV, binging on movies. It's one of those things where you can just turn your brain off and relax and put your feet up. And I'm not embarrassed to admit that I like some really bad TV and I like some really bad movies too. Because sometimes you just want to turn your brain off at the end of the day.
Yeah.
I get to the gym, do a little exercise whenever I can. I think the physical release of that's important. I know people will tell you that exercise is not supposed to be like a mental therapy kind of thing. It's not supposed to be, a way to collect yourself mentally or emotionally, because you're still physically exhausting yourself. But for me, it is.
I agree.
I mean, people that say that, I frankly disagree.
I agree.
I think there's something about the solitude of that. And so I think that's really about it. It's take care of myself as much as I can, some fitness, and spend as much time as I can with my family.
Yeah. So when it comes to bad films, what are some bad films or TV shows that that are not critically acclaimed, but you're a big fan of?
I'd say the worst possible thing that I like to watch. Any bad reality show with Gordon Ramsay.
Yeah.
There's something to be said about watching somebody else get yelled at and beat up on that I guess is just not, it's a guilty pleasure.
Yeah, it takes you back to your training days,
it takes you back to training, takes you back to, being humbled,
Yeah.
And to not be on the receiving end, I guess, is somewhat rewarding.
Yeah, I mean, there's a good and bad with him. He's telling the truth, as
Yeah.
he sees it. And a lot of times, aside from your parents and your spouse sometimes, and maybe a coach or a mentor, not too many people are going to tell you the absolute truth.
Sure.
It's going to be sugar-coated to some degree.
Well, and sometimes I think there's a small part of us and all of us deep down that wishes we could approach situations with that level of candidness and that level of bluntness.
Yeah.
But you can't talk to people that way in real life.
No, our egos are too sensitive and across the board.
It's tough. Yeah, you can't always accomplish things in real life that way. It's fine for reality TV, but not for real life.
Yeah. And earlier you had talked to me about, there was a book that you liked called The Premonition by Michael Lewis. What did you like about that book? Well, first, the book kind of gives an overview of...
Yeah, it talks a lot about COVID. It talks about a lot of what happened during the pandemic. And I know it's kind of nerdy to read about books about what you do every day, but, it was interesting because I think looking back on the 3 years, like the one thing I always tell my kids, I tell myself, I tell everybody is that you should always be able to look back on something and say you learned something.
Yeah.
Maybe you learned that you were doing things right. Maybe you learned that you were doing things wrong, or maybe you just have a general better understanding of what you were doing, forever, how much time you're looking back on. So for me, I want to hope that we learn something from the past 3 years as we move forward, and so reading Pandemic was exciting because it talked a lot about, disease. It talked a lot about pandemic preparation. It really opened my mind up and my eyes to why we did some of the things that we did, because I knew they were probably the right things to do from what I'm seeing on TV and from what I'm reading. But to understand the historical background for those things really put things in a different context and kind of gave me a different perspective.
Yeah, I mean, I think we got to be fair when we look back at the pandemic and say we haven't had a big pandemic like this in about 100 years. And everything for sure will not go perfectly. Just because it's such a rare event, and I think if we look back, we can say we did some things right, and it was certainly suboptimal in many areas too. I think everybody's, most people's effort was in the right place,
Sure, or their hearts were in the right place.
Yeah, but it's just not going to go perfect. Nothing does.
No, it doesn't. But I think, again, at the end of the day, if we can look back on it and say we learned something, I think that's a win.
I agree. And I remember a tweet that came out like 2 or 3 years ago, and Elon Musk said, I hope this prepares us for the big one, saying if there's another pandemic in the future, we've learned some things and we know how to kind of deal with it more appropriately.
Yeah, absolutely. Absolutely.
And so, Michael Lewis is interesting. His books, there's a little bit of a common theme as he goes through his books, in that he kind of will challenge power structures.
Sure, like Moneyball.
Yeah, like Moneyball, Liar's Poker, and this book, The Premonition, which he kind of does that to the federal government to some extent.
Yeah, that's a whole other part of the book is that power structure, like you said, of the federal government. There's almost this semi-underdog story.
Yeah.
In all of Michael Lewis's books. And to hear about, these people, within a small part of the government trying to rally the big part of the government to kind of see what they're seeing.
Yeah, it seems like he likes people who are disruptors, people, and it's like an inversion.
Yeah, that's
of the
a better way
power
to describe it than underdog. Yeah.
It's like a person that's lower down on the food chain, not the head honcho who kind of sees what's going on.
And they see things from a different perspective because they're low on the food chain.
Yeah, and then they're more boots on the ground, right?
Yeah.
Instead of the generals, and they see kind of a clear picture of what's going on, and then a lot of these books, and some of them have been turned into movies, focus on how do you get the message out? How do you, sway the generals to kind of move things in this direction or that? And this is not a new problem. This has probably been around since the Romans or before. But he always does a good job of kind of finding the right characters and the essence of the characters. And
absolutely.
And so anyway. It's been a kind of a wild few years, but here we are. We're on the backside of it, and we're moving forward. And COVID, is it all but dead, or what's going on there right now? Currently?
I mean, it's definitely still around. I think it's going to be something we're going to be dealing with for a long time. It's something that's going to come and go. It's going to ebb and flow, wax and wane, whatever you want to call it. It's going to be there in the background, and whether or not it's going to ever be as severe as it once was, only time will tell. 2009, swine flu, similar situation. Influenza's been around for a long time. Nobody knew when the next epidemic or pandemic was going to come around. In 2009, swine flu hit. So we don't know.
Yeah.
And so it's just a matter of being smart, being prepared, and understanding, what it means to be sick.
Is the current severity of the coronavirus, is it similar to like prior coronaviruses? It seems like the severity of the illness.
I'd say in general, we're not seeing people come in quite as sick as they once were.
Yeah.
But we still do have the occasional person that comes in really sick.
Yeah.
And so I think it's hard to know for sure what to expect.
Yeah.
Right now, despite numbers kind of coming up and going down periodically, we're still sort of on a heightened sense of awareness. Is probably the best way to describe it.
Yeah. One thing that really came to my mind during the pandemic, you talked about working out and the health of healthcare workers kind of came to a forefront because
for sure.
A lot of our colleagues and coworkers, got sick, and we know that the healthier you were, on average, the healthier you were, the better you endured the COVID virus infection, and so it came to light. To me, I thought I needed to get in better shape.
Sure.
I need to eat a little bit better, exercise a little bit more. And of course, we all think that, but it really kind of came to a head.
Yeah, healthy living is a big part of anything. I tell my patients in the office all the time with COPD that the first letter of COPD is C. It's chronic. That means it's not going anywhere.
Yeah.
Whether you like it or not, you have a chronic condition, and healthy living is sometimes more powerful than any inhaler, any pill at the bottom of a pill bottle, any shot in a vaccine. Healthy living is a big part of being able to handle a chronic condition. And in the case of COVID, handle an acute condition.
Yeah.
And so simple things like exercise, nutrition, diet, weight loss, it's like having extra money in the bank for when that big bill hits, that car accident comes along, having a little reserve to fall back on, having a little security blanket. It's nice financially, and it's also nice physically. It's nice mentally. It's nice emotionally to have that physical, security blanket of health and wellness and well-being.
Yeah, that's a good way to put it.
And so having that could get you through something like that.
And we have a pulmonary rehab department, and I walk by there every morning and every evening when I go to my car.
Yeah.
And I think that's been very helpful for patients.
It's huge. Pulmonary rehab, pulmonary rehabilitation, is a big part of helping patients with chronic lung disease, get healthy, get well, stay healthy, and build up some of that reserve.
And so it looks like they're doing mostly cardiovascular exercises and slowly increasing.
Yeah, to some extent. The main focus of pulmonary rehab is to work on those sort of large muscle groups, legs, back, hips, the kind of things that you can physically train, the things that you can physically improve, so that the rest of your body isn't working as hard.
Yeah.
Having a stronger foundation, for your body can take some of the pressure off the heart, the lungs, and everything else.
Yeah, and then their strength and stamina improves, and their quality of life goes up because they're able to go to the baseball game.
And there's scientific proof of that too.
Yeah, and I'm sure there's mental and emotional benefits too from. Just
some of the patients that go there and they come back, they say that a lot of it's just being able to see other people. Interact with other people, the accountability, someplace to go, someplace to be. For some people, it's knowing they're not alone dealing with what they're dealing with.
Yeah.
And so much of it can be mental too.
I've got to give a quick shout out to Nurse Sherry, who's down there. I always love seeing her, and she's always very optimistic and hopeful. And so anyway, shout out to Nurse Sherry. She's great, and she helps.
It's a great team.
It's
a great team.
Yeah.
I don't know. It's a big part of what we do here at St. Luke's to help people with chronic conditions.
Yeah. So Bobby, if you had to give one piece of advice to people out there listening to this, what would you tell them?
Wow. That's a tough question. So one piece of advice, I'm going to focus it on respiratory, I guess, things that might matter to me or help me. I think we talked a lot about exercise, and so I think that's good for like everybody in general.
Sure.
But I think what I'd probably tell people more than anything is that if you're a smoker or if you're a former smoker, quit smoking. Yeah. Stop smoking. I think that would be it. Anybody to work with them to quit smoking. If you're a smoker, do everything you can to quit smoking. I think that's one small part of what we do on a day-to-day basis, but It has really far-reaching implications, for whether it's lung health, cardiovascular health, your mental health, how it affects your family, probably your social dynamic and emotional health at home. I think quitting smoking would be the number one thing. And if you're thinking about starting, don't,
Yeah. So is there a method or a technique quitting smoking that you found to be more beneficial than others?
Yeah, it's a good question. Quitting smoking is a tough thing, I mean, there's the data, there's the science part of it, and the research would show that pharmacologic therapy like Chantix is going to be your most successful, when it comes to quitting smoking. But I think for every individual, it really has to be catered. Yeah. But the one thing I'd say that's consistent, whether you take something like Chantix or whether you use like a nicotine patch, for some people, I know vaping still has a lot of controversial, issues around it. Mm-hmm. But for some people, it can be a way to quit smoking. But no matter what you end up picking, I think the number one thing that works the best for all people is preparation. Measure twice, cut once.
Have a plan.
Have a plan. Pick a date. Don't do it when it's something stressful, like don't plan on quitting smoking when you're going to go do your taxes.
Yeah.
It's not going to go well. Yeah. Don't do it at the holidays when you're stressing about affording Christmas gifts for the year. Do it when there's a time that's nothing stressful. Make sure you tell everybody around you that you're going to be angry, you're going to be cranky, you're not going to be the kind of person you were that you think of. Social gatherings you might not be the life of the party when you're there. But I think the one thing I'd say to help people quit smoking is preparation and planning.
Yeah. Can I add to a couple of things that I found beneficial? If you're a family member of somebody who smokes, it's better to show them a little bit of grace. I think being hard on people for smoking, whether you're a doctor or a spouse, is not real helpful.
No, it's not.
I think you want to show somebody some grace and realize it's really difficult to stop using tobacco products. Sure. And I think most people know that smoking is bad. Yeah. Yeah, it's not a logical issue. It's a psychological
I don't think that
issue.
there's anyone that comes in and says, what I'm doing is okay.
Yeah.
I don't think that happens when it comes to smoking.
Yeah, it's very
You may
difficult.
have some people that have reconciled that they're at a certain point in their life and they're not going to see themselves get better.
Yeah.
But they still know what they're doing is wrong.
Yeah, and the other thing too is I think it's important for people, not just with smoking, but with a lot of things in life, to forgive yourself. Like, we've all had past transgressions. We've all screwed up in the past. And if you're kind of torturing yourself and not with self-resentment, I think it's hard to make future progress.
Sure.
And so a huge part of life is forgiving yourself and just moving forward the best you can. Well, Bobby, it's been really nice talking to you.
I appreciate it. Thank you so much.
I always appreciate you and respect you as a physician.
I appreciate it. Thank you. Likewise.
So thanks for meeting up with us.
Perfect.
Yeah.
Thank you for joining us for this episode of Doc Discussions with Dr. Jason Edwards. Be sure to check out our other episodes and tell your friends.